We are just launching a program in a rural training in family medicine. It's what we call a 1-2 program, in which you do a year of training, which will be at Rockford, Illinois, and 2 years of training in Monroe Clinic. Our fellowship programs is actually additional training beyond a family medicine residency training program, which you get additional experiences in either hospital medicine or emergency medicine.
Including ENT, urology, neurology. We have 2 neurologists, well-established orthopedics, excellent general surgery, very robust behavioral health program. I think you're going to see more things and actively participate in more things here because there's less people ahead of you, to be honest. You're the person working directly with the attending.
I think it's a huge advantage really to be somewhere where there aren't, where it's not saturated with other students and residents. I think that there are a lot of places to get good training, but you're not going to get lost in the crowds. You're really going to get, you're going to get individual attention. You're going to get to do more and see more and learn more.
I found that during my rotations, I was able to see a lot of my own patients. All the doctors that I was with would let me go into the patient rooms, talk to the patients myself first, come out with my diagnosis and my treatment plan, and then we'd go in together, and I thought that was really awesome. So Monroe Clinic has a lot of DO physicians, and for me being a DO, it's great. There's DO pediatrics, there's DO dermatology, there's DO general surgery, and a lot of DO family physicians here too, and I think that's really great.
Education is very similar in a lot of different programs. The reality is you go from one residency to the other, you're going to get similar educations. I think you're also looking beyond that for what does the area provide, and what is the overall feel of the hospital.
We're very advanced with their electronic health record system. We use a system called Epic. It's integrated completely throughout our system, and so that includes hospital and all of our branch clinics. So you're able to access electronic health records from your home. We'll soon have ability to access electronic health records from your smartphones. Your patients that you care for will have some opportunity to get some of the most outstanding advanced care available in healthcare systems.
The facility is state-of-the-art. Monroe Clinic is LEED certified, which means they're a leadership in energy and environmental design, which means they're kind of a green place, which is another thing that you don't see anywhere else.
And I think we have a fairly stable population of providers here. I think in general, physicians and APPs are happy here, and they generally stay here for the long term.
We really want to equip and prepare any resident or any fellow to be very successful in a changing healthcare market. Our organization also strives to be in the 90th percentile in whatever we do. So when we look at our patient care, we look at specific quality outcomes around chronic disease measures and episodes of care, and even cost of care, and we want you to go away being very successful and being in that 90th percentile.
I would ask them to choose Monroe Clinic because I chose Monroe Clinic. I actually moved from Chicago. Now I'm here. I love this place a lot. It is a beautiful place, small town in the middle of not too far from the city. Life, beautiful farms, nice people, very welcoming people, very respectful people, with a lot of festivals. We have a lot of breweries here and cheese festivals.
One of my favorite festivals here, there's lots of little festivals, but Cheese Days obviously is the main one. It's big dairy part of the country. We make beer and cheese, that's the big thing. So there's lots of opportunity for Lipitor.
I think it's a great area to raise a family. My husband and I started a family here, and we get the yard, and you have the park that's just a couple blocks away. So there's a lot of the things that you kind of would associate with a smaller city, and there's just a community feel here that you're not necessarily going to get somewhere out, somewhere bigger. At the same time, if you need to be somewhere bigger, there's plenty of cities within driving distance that have the more urban feel.
Chicago's within 2 hours, and then Madison's less than an hour away. So if you want to go and spend some time shopping or doing something else, there's something always close by here in Monroe. I got a lot of one-on-one contact with patients that you just don't get at other places. So, I thought overall that Monroe is just a perfect place for a medical student or resident.